So finally, these are the guidelines. These are the two main guidelines for the US, and the question is, how does thermography fit in? The standard guidelines, the American Cancer Society, has been yearly mammography beginning at age 40. Then a couple years ago, the American College of Radiology, Society of Breast Imaging, American College of OB/GYN Physicians all recommend that one. Then a couple years ago, it came out, the government guidelines that you don't need a mammogram before 50, and it should be every other year after that. So those are the two main, and they do something close to that in Europe. They varied, I believe. I don't know the details, but I know it's about every other year, every third year. So those are the two main guidelines. And the question is, how does thermography fit into that? There's no specific guidelines. You're not going to get a guideline on thermography from a system here that doesn't even know what it is. So that's the issue that women face. And to me, of all the different studies I've seen and comparing them, this is the key point. 98% sensitivity. CBE is clinical breast exam. Thermography and mammography combined gives about picks up 98% of the cancers in this study. And that's where if you take the issues out of who's going to pay for this and is insurance going to pay and all that, and you just take the science and just say what would be the best thing if you want to find the most, it would be this approach. Because the fact is, mammography misses breast cancers. It doesn't find every breast cancer. Thermography is not going to find every breast cancer. Both will find most, neither will find all of them. And unrealistic expectations are part of the issue on both sides. Mammography has been promoted for awareness, that's great, but if you over promote it, there's an implicit promise that we're going to find your breast cancer, and the fact is it won't all the time.